NACI. In the past, they have come under fire for some of the confusing things they have said. Now this. Take it apart for us. What do you think?
There isn't an ICU physician in this country, in Saskatchewan and Ontario, in Quebec, in Alberta, that does not have someone who is in their 30s and in their 40s, and certainly in their 50s, in the ICU fighting for their life. There isn't a day where we're not admitting more and more of those 30-year-olds and 40-year-olds. And the idea that we are giving this confusing message to say, you know, if you want to wait, if the statistics in your area are friendly to waiting, then go ahead and wait. I mean, the numbers in Alberta and Calgary specifically are more per capita, are more than India. The numbers in Ontario are coming down, but by no means are good numbers. Saskatoon and Saskatchewan is about to go into a surge in the next few days. Regina is out of control. And so the idea that, you know, if you are in your area and you want to wait, go ahead and wait, is at face value is a very reasonable idea, except it doesn't match to reality. I mean, unless you are in Nunavut or in the Atlantic bubble, and only then maybe that could be the case. But otherwise, you know, the numbers don't actually match up to reality.
Yeah, and so just to dig a little deeper on this notion of, you know, take the vaccine that you want. Maybe if you'd like to wait, you can wait for, you know, the Pfizer or the Moderna vaccine. And I'm just thinking about all those people who got AstraZeneca and now are going to think, wow, maybe I shouldn't have. Maybe I should have waited. And I'm already seeing, Dr. Masri, on social media, people angry at what NACI has said, you know, whether it's unintentional or otherwise, just again, sort of this kind of chaos factor that you're injecting into this. We thought we knew what to do, and now we're being told, oh, well, you know, if you'd like to wait until June for Pfizer, you can do that too.
Absolutely. I mean, clear communication, extremely important. And unfortunately, this is the second time in less than 2 weeks, NACI's communication could be actually quite confusing. And it adds more into the notion of hesitancy towards this vaccine. We're talking about a vaccine that has been given over 120 million times, 140 million times actually in Europe. And the incidence of these clots continue to be, they mentioned 1 in 100,000, continue to be in Europe in the range of 1 to 3 per million. We need to clear message on this vaccine. You know, every day an ICU physician is admitting someone to their ICU in their 30s and 40s and 50s. We need this vaccine. The advice should be take the first vaccine available to you and take it today.
Yeah, and we keep coming back to this notion that, you know, there are just perhaps too many players on the field, so to speak, that, you know, you're hearing one thing from NACI, the Advisory Committee on Immunizations. You're hearing something else from provincial officials, something else from Public Health Agency of Canada. Then Health Canada weighs in. What we do know, we just heard from Ontario, is yes, whatever vaccine is offered to you, you need to get it ASAP. Let me ask you about Johnson & Johnson, though, and NACI saying, yes, for people 30 and over, they are now recommending it can be used. It doesn't mean those doses are going to be deployed yet, because we still have to make sure that they are safe after concerns over the manufacturing facility in the States where they were made. But nevertheless, what does that mean for the so-called one-and-you're-done vaccine that Johnson & Johnson has?
Johnson & Johnson is a great vaccine, especially for those young folks who are more likely to have a decent, you know, response from the vaccine. But also, if they were to get a mild illness, they're unlikely to land in the ICU. And also, it is a one dose, which makes it more likely for young people to get that dose, because sometimes we may have trouble having people come back for their second dose. This will be a game changer. In the United States, right before it was stopped, it was making a huge difference in a lot of the states that were deploying Johnson & Johnson. I love Johnson & Johnson vaccine. I think it will make a huge difference to our efforts. And unfortunately, just like AstraZeneca, it has been involved in unnecessary controversy, mostly because of poor communication and lack of connection to reality.
Well said. Another question I've got, in positive news, the fact that we're going to be getting a lot more doses of Pfizer throughout the month of May, and I believe it's around 2 million doses or so each and every week. Plus, there are the Moderna doses, AstraZeneca, and eventually, hopefully, Johnson & Johnson as well. So we're starting to see the numbers ramp up fairly dramatically. I know that in Ontario, for example, they're planning to open it up to everybody 18 and over by the end of the month.
Amazing news. We know that the first dose of the vaccine, any vaccine, after 2 weeks of receiving the vaccine, is leading to a substantial reduction in hospitalization, up to 94%. In all of the country, when I communicate with my fellow ICU physicians, there's been very, very, very few cases where someone has received the vaccine and it's been more than 2 weeks and then they are sick with COVID-19. Otherwise, we're really not seeing anyone, for the most part, who has received the vaccine, whether it's Pfizer, AstraZeneca, Moderna, and it's been more than 3 weeks and they're landing in the hospital. We're talking about, a handful of cases versus hundreds and thousands of cases previous to the vaccine. So, getting 2 million more vaccines into the arms of Canadians is amazing news and is a way to really take the pressure off the healthcare system, have a big step towards, having more decreasing numbers, an economy that could be thought of to reopen again, etc. This is great news, and we really need to get those 2 million doses into the arms of Canadians right away.
Yeah, Dr. Masri, I really appreciate you taking the time. Hopefully, you'll start to see the impact where you are on the front lines there in Saskatoon.